Hi, my name is Kiera Waters, and in this video, I'm going to be performing Trach Care. So the first thing I'm going to do is check my orders. And once my orders have been checked, I'm going to gather up all my supplies, which I have here. And then I'm going to go in, identify myself. My name is Kiera Waters. I'm the nurse that's going to be with you today. And I'm just going to perform Trach Care on you. If you don't mind stating your name and date of birth for me. I'm going to verify with my patient's armband that I have the correct patient. Now I'm going to wash my hands. Once I finish washing my hands, I'm going to put on the PPE that I need, a gown, a mask, as well as some clean gloves. And once I have my gloves on, we are going to remove the soiled pad, and we're going to discard that. Next, I'm going to pre-oxygenate my patient and allow them to do like 5 to 6 breaths. Once they've been oxygenated, and they also could be done with a resuscitation bag, as long as it's just 100% oxygen. Once they have been pre-oxygenated, then I'm going to remove my gloves. And then I am going to wash my hands. After washing my hands, I'm going to open up my trach kit. Once that is opened up, I'm going to take my sterile gloves that's on top, set that to the side. Then I'm going to take my sterile field, and I'm going to lay that using my 1-inch border. And then I'm going to take the contents inside and dump onto my sterile field. Once that's done, we're going to take our solutions, peroxide, pour that in, sterile saline, pour that in. And if it was already open, I would lift the solutions and also check expiration. Once that is done, for video purposes, I'm going to move this. I am going to now put on my sterile gloves. Once again, making sure that I will touch the 1-inch border. Okay. After that, I'm going to put on my sterile gloves. Once my sterile gloves have been on, I'm going to now arrange everything on my sterile field how I need it to be. Okay, once that's done, I am going to take my inner cannula, and we're going to slide this on out. And we're going to soak it in our peroxide. So with that being soaked, I'm going to take my brush and I am going to clean my cannula on the outside as well as on the inside as well. Clean it real good, and I will soak it in my other sterile saline, and then clean it with my brush, making sure it's all clean. Then I will discard my brush once it's thoroughly cleaned and all the soiled area is removed. I'm going to take me, I'm going to dry it. Dry it really good. Okay. Once that is dry, it is ready to be inserted back. Once that is back, then I'm going to take my cleaning Q-tips, clean around the area, continuously cleaning, making sure everything's clean. And I could also use me a gauze, soak it if it's really sore, and clean around the area as well. Once that is done, I'm going to now take my new gauze and we are going to nicely secure that around. So that would be nicely secured around. And then I would take my new string. And before I remove my old one, I would just insert the new one. Make sure it's tied to where, if need be, if there was any swelling, anything like that, it could be nicely pulled out. And it'll be nice and tight based upon the patient. I will do the other side as well, nicely secure that. And once that is done, I will just remove the old one, take it completely out, and then I would discard everything. I would remove my PPE. I would wash my hands, and I would document in my chart everything that was done, patients, how they responded, and that would be the conclusion of the video.